What actually is coronavirus? How it can be caused? What major precautions I should take after the lockdown is over? How worse its effect can be? Don't worry, we got you all caught up about everything you need to know about this virus. Coronavirus disease COVID-19 is an infectious disease caused by a newly discovered coronavirus. MERS coronavirus, which is Middle East Respiratory Syndrome coronavirus, and SARS, Severe Acute Respiratory Syndrome coronavirus. Coronaviruses are circulating in animals, and some of these coronaviruses have the capability of transmitting between animals and humans, which is known to be spillover event. People infected by this disease will most likely to experience mild to moderate respiratory illness and are able to be recovered with any special treatment. However, old-age people who are already under some medical conditions like some sort of diseases such as cardiovascular disease, diabetes, chronic respiratory disease, and cancer may develop a serious illness which even may cause death. At this time, there is no specific vaccines or treatments for COVID-19 available, but symptoms can be treated. However, there are many clinical trials which are trying to find a vaccine for COVID-19, and there might be a vaccine till this September of 2020. However, Oxford University has come into the partnership with an Indian organization known as Serum Institute of India (SII). As we know that India is the largest producer of vaccines, it can help the whole world if this clinical trial is successful. India has already started the production of 40 million vaccines without knowing if it is going to be successful, but nothing comes out without risk. But wait, that doesn't surprise you? Maybe this will, that if that clinical trial works, then India will be exporting the vaccines for 0.50 cents. How cheap it is to save a life? Isn't as wonderful. But is under process which can't be sure of or rely on. The COVID-19 virus primarily spreads through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. There are guidelines from WHO to slow the transmission of COVID-19 and prevent the infection. Wash your hands regularly with soap and water, or clean them with alcohol-based hand rub. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Making sure that your meat is cooked thoroughly before consuming. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and staying away from large groups of people. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. Most common symptoms are fever, dry cough, tiredness. Less common symptoms are aches and pains, sore throat, diarrhea, conjunctivitis, headache. Loss of taste or smell. A rash on the skin, or discoloration of fingers or toes. Serious symptoms are difficulty breathing or shortness of breath. Chest pain or pressure. Loss of speech or movement. Seek immediate medical attention if you have any of the serious symptoms. Always call before visiting your doctor or health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. We would like to thank WHO for providing us with all the information. Please visit WHO.int for more info. If you like the video, hit the like button and share it with your friends. Also, please don't forget to hit the subscribe button and click the bell icon to know more updates on health and lifestyle.